Hey, let me come talk to you real quick. Okay. So I have been in healthcare for a very, very long time now. And I have a podcast, and I can't believe I never thought to talk about the topics that I discuss on my podcast here. Like, duh. So, one of the biggest things that I feel is so important for us is when we are entering the health and wellness space or even the healthcare space, we tend to not know all the things that we should know or even know what to ask. So like, think about it when you're about to get surgery or your loved one is about to have a procedure. And for some odd reason, you always get the question of, so what questions do you have? It's like, I don't even know what to ask. Like, I have no freaking clue. And I think that is an opportunity for us from a health literacy perspective to learn the ins and outs of advocating for yourself. And that's a big thing that I've been talking about over the years in my podcast. And it's something that I'm going to be starting up again now that I actually have capacity, because I don't want you to waste your time when you go to the doctor. I don't want you to feel like you can't get it out, or that you don't have the opportunity to really and truly express yourself and articulate your thoughts, because that's frustrating for anyone to be in that situation, right? So here is what I tell people that I work with all the time, and my family and loved ones, when it comes to preparing for their doctor visits. And that is, again, write down your symptoms, write down what's going on with you. How long has it been going on? When is it exacerbated or made worse? If you have anything with your extremities, do you have pain? Does it get worse when you're doing a particular activity? Does it get better when you do a particular activity? Do you have to take any type of medication? If you're taking that medication, what are the side effects of that medication? Like, did you really look at that pamphlet that you got when you picked up your meds from the pharmacy? Because I will be the first to admit, sometimes I throw it away and I don't even think about it. But the reason why that's so important is because guidelines change as it comes to medications. And for example, with me, when I was taking my thyroid medicine, I was doing really well for a long time. And then all of a sudden, my thyroid levels started to change. And my doctor was like, girl, what's going on? I was like, I don't know. Are you insinuating that I'm not doing what I'm supposed to do? And I got an attitude. I'm not going to lie. I mean, I didn't show it during the appointment because we have a very good rapport. But I'm like, girl, I've been doing my thing, okay? I've been taking my medicine at the right time, waiting before, and an hour before I eat, doing all the things. And she was like, your labs say something different. And I also want you to learn from me, because I went, and I did my little search, and I have my journal, because, I like to write down my food journal and have that all recorded so that when I go to the doctor, I can be like, no, I was doing this. Yeah, I was eating a lot of vitamin D rich foods. And when you're taking thyroid medication, that can interfere with the uptake of your meds. Yeah. So we also have to recognize when we are doing things that are not helping us. And fortunately, my endocrinologist is great. And she was like, Ebony, so let's look at the guidelines together. They have changed. And you really want to wait about 4 hours before you're taking any supplements or you're having those vitamin D rich foods. So we work together to kind of readjust what I was having for breakfast. And then she's like, once you hit that lunchtime, you can take the rest of your supplements, and you can also really have those vitamin D and calcium rich foods post that lunchtime hour. So that was a really important thing to know. But I was like, yo, doc, when did this change? She was like, oh, a couple years ago. I'm like, I've been taking this medicine for how long? Why ain't nobody tell me? She's like, unfortunately, we don't always have the bandwidth to be able to communicate that to patients when things like that change. And I said, okay, that's cool. But how am I supposed to figure this stuff out? How would I know that? And what we decided to do was we pulled up a couple of resources. I know I tend to look at the Mayo Clinic, Johns Hopkins, Mount Sinai. I look at all of the endocrinology nonprofit sectors so that I can just get on their email list. I go to the Autoimmune Association to just make sure I'm staying on top of any like new and upcoming things or treatments as it relates to my condition. And I said, okay, well, I will continue to monitor these things to make sure I'm staying on top of this. But at my next yearly visit, is it okay if we revisit these things, including not having to monitor my antibodies all the time? Because it's kind of like when you get an autoimmune disease, you kind of got it. That's not to say that I can't still live well with it, but you may have elevated antibodies for a while. Actually, let me rephrase that. I have elevated antibodies. That's between you and your doctor. I'm not getting on the internet saying that you could put your autoimmune condition in remission or anything like that. That ain't none of my business. That's between you and your doctor or your provider, not me. That's outside of my scope of practice. But in all seriousness, it is really important for you to learn these things. And that's why for me, I'm like, okay, I got to get this community situation going so that we can talk about these things. And the other thing that's really important is recognizing when your doctor doesn't necessarily have that time to go through that. Because I know my practice, they have scribes. So the scribe can take the notes while the doctor or provider and I have conversation. You may not always have that luxury. I will talk about my chart or the patient portal in another video because I feel like a lot of people don't realize that, yes, physicians and providers are charging for those messages, but there is a way that you can be sure that you get your needs met, because what people don't realize is you end up explaining all the things, and that will take quite a bit of time to go through. And if you have a complex case or complex history, that ain't gonna be no quick message. So we'll talk about that in another video. But for right now, we got to start working on our health literacy and our digital health literacy.